I, Chair Shelley Bailey, call the Prescription Drug Affordability Board meeting of June 26, 2024 to order at 9:32 a.m. Pacific. Melissa, could you please call the roll?
Chair Shelley Bailey.
Here.
Vice Chair Amy Burns.
Here.
Dan Hartung.
Here.
Robert Judge.
Here.
Chris Lehman.
Here.
John Murray.
Here.
Akil Patterson is excused. Dan Kennedy.
Here.
We have a quorum.
Thank you, Melissa. So before we proceed with our meeting, I would like to ask any board members here today if they have any declarations they would like to share related to a real or perceived conflict of interest. If you do have such declarations, please raise your hand. I think I saw Mr. John Murray's hand up first. So Mr. Murray, if you could please, you have the floor to share any declarations.
Thank you, Chair Bailey. Under advisement from the Oregon Government Ethics Commission, I declare a potential conflict of interest due to my ownership of Murray Drugs, comprised of 3 independent pharmacies in Eastern Oregon that have pharmacy services contracts with PBMs, insurance companies in the state of Oregon. Thank you.
Mr. Murray, thank you. Let's see, Dr. Hartung, you have the floor.
Yes, I want to disclose that I have 2 potential conflicts of interest for an agenda item on today's agenda. I have a consulting arrangement with the National Multiple Sclerosis Society to support some of their advocacy work. And I have received consulting fees for research from Sandoz Pharmaceuticals, who manufactures a drug for multiple sclerosis. So I will recuse myself from our discussions about that drug on the agenda.
Okay, thank you for sharing that today. So I guess I would now like to know if any members here today have any changes to the draft minutes from our May 15th, 2024 meeting that you would like to present before our colleagues here today. So if there's no suggestions related to amending the minutes, do I have a motion to approve the minutes from our May 15th, 2024 meeting?
This is Chris Lehman. I'll motion to approve the minutes.
Thank you, Chris. Do we have a second?
I'll second.
Thank you, Dr. Burns. Melissa, can you please call roll related to the May 15th, 2024 minutes?
Dan Hartung.
Aye.
Robert Judge.
Aye.
Dan Kennedy.
Aye.
Chris Lehman.
Aye.
John Murray. John Murray.
And Melissa, while we are waiting for John Murray, maybe he has left or is coming back, I did want to mention related to Dan Kennedy, since Dan wasn't part of the previous meeting, should we recuse him from meeting or voting on the minutes?
We could do that. Yes, but
is that acceptable for you, Dan?
Yes, I was just trying to be agreeable. But yeah.
I appreciate your efforts to help support your colleagues here today. Let's see, related to Mr. John Murray, can we confirm if he's in the meeting?
I'm sorry, Chair Bailey. I couldn't unmute there for just a moment, but I can now. I support.
Okay, you support approving the minutes?
Yes, thank you.
All right, thank you.
okay. Thank you. Vice Chair Amy Burns
Aye.
and Chair Shelley Bailey.
Aye.
Motion passes.
Perfect. Thank you, Melissa. I would now, next on our agenda, like to call Executive Director Ralph Magrish to the floor here to provide us with a program update.
Thanks, Chair Bailey. Can I just make sure everybody's hearing me okay? Great. Thank you so much. So appreciate Shelley's recognition of Dan, and we'll start my updates there. First, really enthusiastic, heartfelt welcome to our newest board member, Dan Kennedy. Just a little bit about Dan. As a pharmacist, Dan Kennedy brings more than 30 years of experience in Oregon to the PDAB. He's been involved with many state programs throughout his career, including the original Health Resources Commission, which for folks that have been around for just a little while, that was the predecessor to the current Health Evidence Review Commission. Dan was engaged with the Oregon Pain Management Commission, the Prescription Drug Monitoring Advisory Program Advisory Committee. His experience in managing both hospital, clinic, and retail pharmacies, as well as his past advocacy work, we think will suit the PDAB very well, and hoping to broaden our perspectives and recommendations to the legislature. So again, Dan, we welcome you and thank you so much and look forward to your meaningful contributions to our work. Continuing in the spirit of welcomes and introductions, I want to also recognize and introduce Heather Doyle, who is with us this morning. Heather is our newest staff person on the PDAB team. She is our new data analyst, and she is joining us from the Department of Justice. We are very excited to have her with us. I will share that we are also in the process of hiring a new research analyst. We should have an update and hopefully an introduction to you at the July meeting. Moving on, we'll also flag that we do still have a board vacancy. That position, as mentioned at last month's meeting, is still posted on our website. The recruitment actually will be closing on Monday. Again, as mentioned, requirements for that per statute are to have a background in clinical medicine or healthcare economics. So any interested parties should certainly consider that and submit application through the Workday process. Again, available on our website by July 1st. I will also share, and I'll speak to this in my Senate Bill 192 upper payment limit update, but wanted to mention here that we have had a request for tribal consultation as it relates to the upper payment limit planning. As we included tribal pharmacies in our survey process, tribes have exercised their rights to request that formal consultation. Did in fact send them a tribal leader notice letter with some supplemental materials on the 13th and anticipate scheduling something over the summer with the tribes. Whether that turns out to be individual consultations or a broader consultation remains to be seen, but certainly we'll keep you all apprised of that. We'll also share that DCBS did host a rulemaking hearing yesterday on the combined fee structure to fund both the Drug Price Transparency Program and PDAB. That was also included in Senate Bill 192, and those proposed rules are available on the division's website, and those public comments period closes on July 2nd at 5 p.m. Couple final things. I will share that I was invited to sit on a work group hosted by Representative Levy that met for its first time yesterday on pharmaceutical manufacturer coupons. I think that will meet on an ongoing basis over the summer, and I will keep you apprised of that. And then finally, this afternoon, I will be joining a first meeting of a state pharmacy interagency collaborative. I think the acronym they are using is PIC, for Pharmacy Interagency Collaborative, that I understand will help understand and improve the coordination and alignment around pharmaceutical initiatives and programs around the state. That will be hosted by the Oregon Health Authority. So I will give updates on that as that group progresses as well throughout the summer and ongoing. That is my report. Thank you, Chair Bailey.
Absolutely. Well, Ralph, thank you for sharing all that additional and somewhat new information. So thank you, and we look forward to your continued updates as you progress through those, I guess, listening sessions. But I would now like to take a few minutes here to speak with my colleagues today in reference that I would like to recommend today that we pause our current affordability reviews, that we implement additional processing improvements, and restart our efforts later in the year. This suggestion is crucial for several reasons, and I believe it'll enhance the quality and the impact of our work for years to come. We've faced significant challenges since our inception. We've been laser focused on meeting the timelines identified in statute. However, all the while working on the affordability reviews themselves, we've needed to create a structure for the board, learn about the supply chain, identify a list of drugs that may present affordability challenges, pare down the list of drugs to conduct the deep affordability reviews. This has placed enormous pressure on our volunteer board members and has led to process challenges that could have been avoided. I'd also like to remind my colleagues here today of some of the language from Senate Bill 844 as it relates to our processes. The Prescription Drug Affordability Board shall study the entire prescription drug distribution and payment system in the state and policies adopted by other states and countries that are designated to lower the list price of prescription drugs. Due to our focus on meeting timelines, we had not had the sufficient time to fulfill this portion of our legislative mandate. While we have made needed process improvements, we are still short of building a systemic approach for our affordability reviews that can be applied consistently to all drugs under review. So restarting the affordability reviews in 2025 will allow us to ensure that our list aligns with the guidelines that we initially sent forth as a board related to the reviews. So postponing these affordability reviews until next year will allow us to overcome data limitations that we've had, both the availability and synthesis that have hindered some of our progress. I believe in the work of the PDAB, and I'm committed to completing the board's affordability reviews. This is an incredible amount of work for us, and it requires us to have full confidence in our processes and ultimately the outcome of our suggestions. This reset will allow us to restart and do some intentional planning over the interim that will set us up for more success next year. We cannot adequately address the necessary pivots in our processes related to the affordability reviews within the remaining time available this year. Therefore, in my opinion, pausing the 2024 reviews will allow us to start fresh in 2025 with a new universe of drugs for consideration, more current data, and applying a more systemic methodology, addressing process and data-related challenges, reviewing feedback and input, and implementing improved and consistent processes moving forward. So in summary, I would like to discuss with my colleagues here today, pausing the drug affordability reviews for 2024, allow us time to regroup and reassess to ensure that our suggestions are thoughtful and meaningful in addressing current challenges related to prescription drug affordability in Oregon. So I recognize that was a whole lot of information just shared today, but I do welcome discussion related to this suggestion with my colleagues here today. So does anyone have, I guess, any suggestions or initial thoughts related to the information that I just shared with you? Related to my perspective?
Chair Bailey, this is John Murray.
Yeah, you have the floor.
I believe in what the PDAB is trying to do. I do very much from my community pharmacy perspective in rural and frontier Oregon. We need to work towards prescription drug affordability. I do see the challenges, and if we proceed on the path that we're on, I think there might be challenges that will come to this board that will be difficult to surmount. Let me put it that way. I like the information that I'm learning as someone who's in the industry and who sees and understands a lot of the information that's come before the PDAB. There's still half the information that is new to me, data sources and evaluation of the information and seeing it in a new way. And then as recently as the UPL meetings that we had these last several weeks, which I know is slightly unrelated, but I still learned so much from the perspective of the people that and the groups that came to talk at those meetings, things that I'd never heard and were not aware of. I think that applies, in my opinion, to our drug affordability reviews. It's not that I want to not do them. I do, definitely. I mean, just tackling the topic of what is drug affordability. Is it my patients that can't come in and afford the GLP-1 agonists that would definitely turn their life around? Yeah, it is. But it's also more than that. And I guess I'm in favor of postponing it and for me, gathering my thoughts and more information on the process, please. Thank you.
Well, thank you for sharing some of your initial thoughts. Robert Judge, I believe your hand was up next.
Thank you, Chair Bailey. Actually, I was struggling to get my hand up. I couldn't find where to do it on the Zoom call. But this is a complex undertaking, and if we look across our peer states that are doing this. Each is kind of on a journey as we are as well. And, my expectation is that, the PDAB pork product 3 years from in the future will be much more robust, much more detailed, and much more informed than it is today. And we're gaining a lot of knowledge from both our listening sessions, the testimonies that we've had at board meetings, as well as kind of our ability to kind of make sense of the data as we've seen it come in. There are huge gaps, I think, as a board member in the data that we have to make an informed decision on an affordability review that's consistent and has consistent criteria for making a determination. And that's just something that I really cottoned on to as I looked at the most recent packet and the assessments, which I thought were really well drafted for our consideration about Shingrix and Ocrevus. But even in reviewing that, I just have questions about what raises to the level of the affordability issue, both from a member perspective or a resident perspective, as well as a payer perspective. And I think as a board, we could probably benefit by tapping the brakes and trying to establish a uniform set of criteria for how we want to make our evaluations. And more importantly, be very clear on the methodologies and sources we want to use for data to help us assess each of the products that we would be reviewing. There are big gaps in APAC. It's hard to make any sort of determination about affordability if we can't have rebates kind of figured in there, manufacturer concessions. I struggle with that. I struggle with coupons and what that does to affordability for members. And these were all factors that industry has brought up. And as given my experience in the industry, I understand makes a net cost is where things are at. So there may be, I understand the legislative intent, but sometimes going slower is faster. So I'm inclined to think that this might be a good idea for the board.
Oh, Mr. Judge, thank you. Thank you for sharing your initial thoughts. Dr. Burns.
Yeah, not necessarily opposed to pausing, but to me, it's still unclear as to how to kind of improve the process and the data sources. As far as I know, there aren't any new magical data sources that we're going to be able to get a hold of. As to what Robert was speaking about, we aren't necessarily going to be able to get that information around coupons and rebates. That's really, as we've acknowledged all along, it's difficult. So there are a lot of challenges, and we're trying to tackle essentially like one of the most complex systems that I have ever encountered, with a lot of different angles to look at as to how do you define what affordability is, as to what John was saying. Like, this is like, there's even just the lens with which we choose to like define the term is challenging. So I'm just a little concerned that we don't necessarily know what a better way forward is, and I wouldn't want to stop the progress that we are making, even though it's limited and it feels sometimes like 2 steps forward, 1 step back, in search of perfect. I don't know that we're going to get there, but again, I'm not opposed, because I agree, like we've definitely run into some issues and we've learned a lot on the way. So if there's a way that we could pause and really regroup and maybe better define and have subject matter expertise that perhaps we didn't have before, I'm all for that. I'm just I feel like we could spend the rest of the year just trying to figure out how to do this, but we've already spent a bunch of time trying to figure out how to do this. So, you know what I mean? It's sometimes you just have to do it.
Yeah, I mean, certainly I hear what you're saying, related to, we can't make, Ralph always has a good saying related to, we can't, seek perfection and, kind of just not do anything during the process. So I hear you. I mean, I certainly have some ideas and thoughts about, how we might, as a board, together build more of that foundation so that we do, yes, there will be, I believe we should have fruitful discussion about what does affordability look like and things. But I personally would like to see us have those discussions. And then once we have defined some of these things, then at least, even though our data won't be perfect, right? At least we will be applying a consistent approach to what we're doing after we've set some of the more kind of foundational guidelines that'll help guide us through the journey. But Dr. Burns, thank you very much. Chris Lehman, you have the floor.
Yeah, I appreciate what you said, Chair Bailey. I think you said it really well. I agree with pretty much everything you said. I do believe in the work of the PDAB and appreciate all the work that Ralph and the staffers have done to develop everything we've looked at and gone through. But I do feel like it's been kind of an evolving process. Even since the time that I've been on the board, we've been changing the format or the things that are in there to kind of make sure all the things that we need to be including are in there. And I think, to your point, if we start with this is what the standard should be, this is how we're going to do it, and then it's that way from the beginning, I think that would help the community members and the pharmaceutical companies or all the stakeholders kind of understand the process, and it won't be evolving as we go along. The other thing that I think has been so just eye-opening to me is to listen to the stakeholder listening sessions. I'm really interested in that report that is going to come out, because there's so many ramifications from the decisions that are going to be made in these recommendations as far as how FQHCs are going to be affected or other people out in the community. And I just want to make sure we're being thoughtful about that as we develop the reviews. So I would be supportive of pausing and kind of resetting as well.
Thank you for sharing your initial thoughts. Let's see, I'm not sure whose hand was up first, but Dr. Hartung, I don't think we've heard from you yet, so go, you have the floor.
Yeah, thanks, Chair Bailey. I also support this pause and reset that you're proposing. I think there are some questions about the veracity and timeliness of the data that we can kind of get ahead of maybe a little bit better. Now seeing kind of how they're laid out with our reports that we've already produced. I think we can get maybe back to first principles of the founding legislation, really thinking about what affordability means, as others have indicated. Is it, it means a lot of things, different things to different people. For certainly for patients and financial toxicity they may be enduring because of the drugs that they have to take, access that they can't get because of administrative issues that are secondary to payers, and then system affordability as well. So thinking, and there's I'm sure other lenses I'm just haven't scribbled down right now. But just thinking through what that means, and having some sort of shared understanding of those different aspects. And then also, I think learning from other PDABs as they're going through in other states about kind of their experiences, what to do, what works, what doesn't work, and learning from the federal government and their development of maximum fair prices for their first round of drug negotiations. I think that's going to inform any sort of current or future discussion about upper payment limits from the state side. So for multiple reasons, I think kind of hitting this reset makes a lot of sense to me. So I support.
Thank you, Dr. Hartung, for sharing your thoughts. Dr. Burns.
Yeah, I'm curious, like when we're talking about doing a pause and I'm hearing different words for this, are we talking about doing a reset or doing a pause? Like what happens to the work that's already happened?
From my perspective, and staff, please correct me if this is not in alignment with what's achievable for us. But I mean, I would like to see us pause review of drugs for 2024, allocate necessary meeting time in our, meetings, throughout the year to rebuild some of those foundational things that Dan, so kind of directly shared what is unaffordable to the patient, what is unaffordable to the system, and really kind of doing that with, new and more current data that we can then use to, restart things for 2025 reviews. So not pursuing a work product for the 2024 affordability reviews. From just my own perspective, that would mean there's perhaps a lot of some of the work that's been used, if those drugs ended up on our list again, of course, we would be, using information that was relevant, but really investing the 2024 to kind of rebuild some of our foundation as a board so that as we move forward for years to come, we all, kind of feel confident in the foundation that we built, that we can then apply consistently to drugs moving forward. Does that answer your question, Dr. Burns, related to my perspective on it?
Yeah, no, it does. Thank you.
Okay, thank you. Mr. Robert Judge.
Thanks, Chair Bailey. So just kind of, I have two follow-up questions. One is, we have the legislative requirement to report out, the 9 drugs this year. How do we thread that needle, given the fact that we have that requirement? And then a follow-up question is, if we're going to kind of pause, reset, rethink, what's the process? How do we proceed from here? So we don't find ourselves in December saying, what are we, we're no better off than where we are today. We know we have the data issues. Those aren't going to change. We know we have issues related to net cost. That's not going to change. We know we have solicitations and feedback and listening sessions that will continue to inform us. But are we going to rethink fundamentally the approach that we're taking here, or are we fine-tuning it? What's your perspective?
I'll answer the questions you asked of me, and then I'll make sure Mr. John Murray has the floor. So related to kind of what happens related to statute, you're probably well aware that I'm not a policy expert, but I can say that, I have briefed legislators that I was intending to bring this to a vote. And so I kind of the awareness related to this discussion that we're having today, I feel as chair, I fulfilled my obligation of making sure that legislators were aware that this discussion would happen today. Related to what I think I'm hearing you say is like, what is the purpose of PDAB? That is something for us as a board to discuss. Obviously, I'm aware of what's identified in statute for us, and I think there's a lot we can do specifically with the guiding statutes that we just as a collaborative group of colleagues here do have to have some, and to an extent, possibly rehab some of those discussions about our kind of how do we want to guide ourselves for years to come related to, what framework. Like, for example, this year as a board, even with our existing statute, we made some decisions that help guide us related to, biosimilars or orphan status. I mean, we did those types of things, but I think we do have to take another step back as colleagues and even, do some more robust discussions about affordability and things. So I can't say, Robert, personally, I have all the answers for that, but I think this is very meaningful discussion that together as a board, we have to have together. So I don't know if that's an answer to your question, but that's kind of the way I see it at this time. Mr. Murray did have his hand up. Mr. Judge, is that acceptable to you? So, Mr.
I
Murray,
just got a follow-up. It doesn't,
go ahead, then go ahead and follow up so we can continue that piece.
yeah, just, I know you put the question to the board about making kind of a decision on the recommendation. I think before the board makes any decision, it'd be really helpful to get Ralph and staff's thoughts. Because ultimately they do a lot of the work here. And I think we'd be better off by, not better off, we'd be helped along by getting their perspective as well.
Yeah, I'm absolutely open to asking Ralph and staff if they want to share how logistically something like this reset could occur. With respect, I'm going to make sure Mr. Murray can share his thoughts before we call Ralph and team to the floor. Maybe Ralph and team as we kind of go through this discussion, maybe we can actually ask them towards the end of it, just so they can hear other thoughts that board members might have. Is that agreeable to you, Mr. Judge? Okay, thank you. So, Mr. Murray.
I was just going to comment that for me, going forward, so as not to end up in December, maybe at the same place, I don't think we would, but for me, next meeting, I'd love to have a discussion on what is affordability. What does this board feel is, what does affordability mean to this board? The information that's been presented to us has all been I appreciate it, and I've learned a tremendous amount. How does that fit into my view of affordability if I don't have that lens, that foundational concept to work off of? And I've struggled with it, and I don't mean to say that I haven't progressed. I have, but you have these drugs that cost thousands and thousands of dollars, but they're life changing. They save a person's life, or they turn a person's life around to where future healthcare costs are so much less, for example. That's the kind of discussion I need to hear and end up with a concept that I can work off of to make decisions. Then I can filter the information that comes to me and say, well, this is valuable.
Mr. Murray, are you still speaking? You may have,
We're going to have more information. I'm sorry.
Nope, just so you're aware, we lost a little bit of your discussion, I think, due to internet challenges. No, so thank you for presenting that. I would like to share with my colleagues. Obviously we do need to have this as an agenda piece of our meetings to have meaningful time. I would like to share a little more information a little later in our board meeting. I mean, just kind of related to timelines, but I am in full support with you, Mr. Murray, that sooner as opposed to later, we need to have these discussions. There's just a few parts of the ecosystem that I'd like us to hear from before we, kind of have that discussion related to back to kind of what is affordability. But I am completely in agreement with the thoughts that you just expressed. So, I recognize this is a very, a very big recommendation to present to everyone here today. So I do want to make sure that we're allowing the time and space for, some of you have referenced how you may be inclined, but, before we vote, I do really want to make sure that we have the time and space for everyone here to share any thoughts that you want to make sure are conveyed before, if we have a motion to vote. So I'm happy to have silence here while people think, if it's helpful to anyone here today. Mr. Judge.
Before we move to a vote, I still do want to get some insight.
Oh, yes. From staff.
Yeah.
Sorry about that. Yeah, I was just wanting to kind of make sure they have the time to answer any questions that may come up from board members before we have a motion to vote, if someone presents a motion. Vice Chair Burns.
I'm just curious because we did have a lot of stakeholders over, probably like a 12-month period where our meetings were having presentations and having various groups come and speak to us, which was really informative. but I'm curious if that's like the intention here again, if we're kind of doing a reset and we want to start having conversations about what affordability really means. Are we going to, in our pause, like have that kind of stakeholder open forum? Is that kind of what you're envisioning?
Yeah, absolutely. I mean, what I'm envisioning that we can discuss more as we kind of get through the agenda, but is exactly that, Vice Chair Burns, to bring all sorts of stakeholders who are identified in our statute, as well as additional stakeholders with knowledge about the distribution system and supply chain, so that all of us board members are hearing, you know, all of us here today have different perspective and professional background, but really trying to make sure that we are hearing from all these groups so that all of us here can kind of level set a bit on our understanding of different and unique pieces. So the educational piece of it is really important to me. And that is, you know, simply why I did share some of that language from 844, because I do feel all of us, you know, have strengths in one area, but maybe not as much in another, and really want to make sure we're hearing all voices and that, you know, we can listen and learn before we, to Robert Judge's, you know, point, before we kind of even define things, that we you know, recollect what's been provided to us previously in our process, and that we add to with additional stakeholders and information.
Thank you.
Absolutely. Mr. Robert Judge?
Yeah, just to kind of put a finer point on what it would be helpful to me as a board member in kind of walking through this deliberation. When I think about the affordability question that John raised, I think about what is the net cost of a product for payers and for consumers after concessions and considerations available in the marketplace. That's a big gap that we may never ever be able to satisfy, given the way data is allowed to be collected and apportioned out. Then there's questions to get to kind of the socioeconomic access questions. There's information that I would like to see about, you know, utilization among different racial and ethnic groups in order, maybe by census tract, poverty tracts, things of that nature, so we can actually see, you know, kind of, or infer if there's potential access and affordability challenges to different demographics in this state. I'd love to be able to figure out, we've done some good work, I think, on the net out of pocket, but we've not associated that to any income levels. That would be really helpful as a board member to kind of narrow in and zero in on what we're thinking about. We know we have gaps with getting manufacturer information on financial assistance programs. But you know, that's a factor that ultimately gets into affordability issues for patients, and industry is, every time they meet with us or talk to us, they say we do a lot. Well, we need to see what that means on a drug level basis and a population level. So, you know, being able to investigate that, I think, would be hugely beneficial to the board in helping us make our mission. And then finally, again, part of it, and if we looked at the Genentech information in the packet that they provided, or responses that they provided, there's all there's continual reference to use medications to forestall or avoid future long-term medical costs. That would be really helpful to kind of say, is there really that type of benefit? We hear an awful lot about it, but can we see it, look at it, and evaluate it? So those are things that I think as a board would be really informative to us to help us kind of fulfill our mission. So that's, when I'm thinking about a pause, I'm thinking about those types of questions that would be really informative to us to, you know, fulfill our mission.
Absolutely. Well, thank you for sharing that. I've obviously been taking notes, and as we all know, these meetings are recorded, so we'll be able to capture all of our thoughts related to things that, you know, we would like to see as a board moving forward. Mr. Lehman, I saw your hand was up previously.
Yeah, Chair Bailey, it was I was debating whether to say it or not, but one of the things coming into the process a little bit later, I haven't had a real good grasp on when one medication from a class has been selected. So say like it's a medication that's not necessarily out of the price range in the class, but it's a really high utilized medication that's having a big impact in the community or in patient population. It hasn't been clear to me like how it's almost like a penalty to the drug company in a sense for making this great drug that's sort of the best in class and being used. And so I like having and maybe that discussion went on in the beginning and I just haven't seen it in the notes or something, but how the decision was made around the choice to select that medication, not other medications in that group, if that makes sense. And so I feel like going back to looking at all the medications again and having an understanding of the process for, no, we're not selecting this class of medicines. This is why we're selecting, this medication or that medication would help me. And I feel like when I'm speaking to the community or the drug companies, et cetera, are making comments, it could be a little more defensible if we had the, I don't know, sort of logic for how that decision was made to pick one drug and not like a whole class of drugs that's having a huge impact. Does that make sense what I'm trying to get at?
It makes a lot of sense to me. And I mean, to your point, right, this board ideally will outlive any of our tenures, related to participation. So to the extent that we have, kind of those foundations, those guiding principles, at least for each year under review, certainly helps us if we have board members that transition because of, career or life changes. And so that consistent approach, Chris, I hear what you're saying related to how that would be very helpful to the board as we move forward for years to come. So yeah, I could, if I put myself in your shoes, joining at a different period in time than when I joined, it makes the learning curve, a little bit more difficult to climb. So thank you for sharing that. Dr. Hartung.
Yeah, I mean, I think my memory is a little dim because it was a couple of years ago, I think, when we started to have these conversations. But I think a lot of maybe there's, we had started to have these very macro level discussions about how to identify the list, how to identify like the candidate list. And I think we just, there are some drugs that are couple $1 million per person. Some of these new gene therapy drugs for sickle cell and things like that are life changing, but then they're very expensive for one or two people. And then there's some drugs that are just expensive but used by a huge amount of people, like Hep C and now the GLP-1s. And so, I think trying to parse these different ways of looking at spending and affordability, we kind of, I think, generally settled on like, what are the drugs that are, because it's the easiest thing, what are the drugs that are most expensive in the state, or that the state we spend the most on in the state, and kind of to winnow down this big list. And then once we got there, we had these, more kind of very more nuanced, granular discussions about, what is the cost per patient, what is affordability? And that's how I think we get some of these, I'm not going to call it an aberration, but like things like Shingrix, which I think the states probably spends a lot on, but, it's real debatable if it's like has a negative cost impact on the patient and is affordability challenge. And so I think, maybe a more deliberate thought about, how we get to that, the set of 10 or 9, and then what happens to those as we transition to the more granular discussions to make sure that we're balancing like kind of these aggregate indicators of the economic impact, more granular understanding of affordability at the patient level would be, we've learned something along that journey. Yeah, I think that was the main comment I wanted to make, just kind of share what I understand, how we got to where we're at.
Absolutely. Thank you for helping to refresh all of our memories from a few years back. Ralph and team, as board members are, just kind of ruminating on the discussion, would you be prepared to share, is this type of pause feasible? I mean, I can certainly, share my perspective of what the year could look like, but I know Mr. Judge had asked if staff could chime in, so I would like to make sure that yourself or someone on your
Sure.
team.
Sure, Chair Bailey, thank you. I'll speak for team in this. And to be very clear, our statute is very clear to that point that our staff, and myself included in that, is to provide support to the board to carry out its duties. So first want to commend all of you in having what has been an important and difficult conversation where you have all been very candid about some of the process issues and challenges and data limitations. So know that the team stands with you, that if this is a vote that should go through, we will reset process to that point to speak a little bit just to a couple of things that some folks have said, because they're legitimate and valid points, and I'll paraphrase where I can in some, but certainly John mentioned, what does affordability mean? That's an important conversation that perhaps we need to revisit again and define. I think there was some acknowledgement around gaps in data that Robert had flagged, and paraphrasing, Robert had said perhaps benefiting from tapping on the brakes. Said differently, sometimes you do need to slow down to speed up. And I'll speak to that in the context that, as board knows, and some of the original members that were seated here, and that there were the competing priorities of, as some folks I think mentioned, of meeting what were aggressive timelines for exercises that had never been done before. So certainly there is recognition of that. I would note something that Dr. Burns said, and that, in search of perfection. Perfection is often in the eye of the beholder, I would suggest, but can we do better? Certainly. To that point, we have said throughout this process that it is an iterative process and it is a learning process. To stay in that kind of spirit and context of something that I think Chris said just a few minutes ago, that, these are addressing some of the data limitations and policy discussions. Policy itself is an iterative process and discussion, and data is a dialogue. So to that point, is there more dialogue to probably be had? Yes. So to that point, can we do that? Of course. Kind of thinking on my feet with this conceptually, Chair Bailey, I would suggest that if this is a vote that would go through, that the board, in addition to its other mandates, and I would speak very briefly to the fact of recognition and gratitude to all of you and the time commitments that you've made, because some of this is in fact about balancing the competing priorities of getting the work done around affordability reviews, developing meaningful and substantive recommendations to the legislature, and the current expectations and lift with our upper payment limit work. So to that point, I would anticipate or recommend a process over the next number of months that is kind of a lessons learned exercise, so that we know what we have in-house and how it can be leveraged. I think it was noted that if in fact there were to be drugs on this year's list that would appear next time, that no need to reinvent the wheel, and certainly to leverage existing resources and data. But perhaps for us to have that lessons learned exercise, identify additional gaps, potentially identify additional data sources. And to that point, finally, again, as this being an iterative process, and I think it was also mentioned that different states are on their own arcs, that if in fact there are limitations to our own statute, that conceptually some of the recommendations and discussions and the takeaways from that lessons learned could in fact be recommendations to the legislature for statutory changes to perhaps dive deeper into certain areas, to perhaps seek permissions or authorities to access different or other data sources, perhaps, as I think Robert was intimating, and to have opportunity to make meaningful changes, which is all of our collective goals. So certainly, yes, speaking on behalf of team, that if this is the will of the board, we support you and we will rise to that occasion for you and support you.
Thank you, Ralph, for that update. Mr. Judge, since you were the one that was making sure we asked that type of update from Ralph, do you have any questions of Ralph related to that, or anyone here today? Want to make sure all your questions were answered.
Yeah, no, I appreciate that, Chair Bailey, and Ralph, I appreciate your kind of being put on the spot and kind of how you responded. This is a complex topic. We all recognize that, and we're going to be always dealing with imperfection, and trying to do the best that we can with this. But I do think, some comments that you made, especially around, I think we all kind of struggle with data, maybe how we interpret data, what we know we can work with, what we know we can't work with, and then how do we do workarounds. Those will all be things that I think as a board we'll have to kind of work with you and your team on. And then, of course, there may be some recommendations we need to make. So thank you.
So I guess I'll ask my colleagues here today if anyone here would like to put forth a motion to pause our 2024 affordability reviews. And I guess I'll ask staff, am I able in my role as chair to put forth the motion? If we don't have one.
Chair Bailey, I have operated on that premise that the chair has that authority. Absent input from council, I believe you do as a board member.
Thank you for asking my question. Then I'll frame things differently. Oh, Mr. Robert Judge. Yes, your hand is up.
Yeah, it's always who's gonna jump in the pool first. I think we've all given kind of voice to our thoughts, and these are difficult. I know I'm not regretting this at all. I'm hoping that it's positive and for the board, so I'd recommend that.
I'm open to providing the motion because that obviously framed the discussion here today. I just wanted to make sure I asked if that was something I was able to do.
Yeah, I make a motion to pause.
Okay. Mr. Robert Judge, thank you. We hear your motion, but Dr. Hartung, did you have a question?
Yeah, well, I was just curious if like how prescriptive does the motion need to be, and like what do we need to propose something, some other interim steps that we're going to pause that, and the next, we have the rest of the year to engage in various cognitive activities to try to hammer out the process. I mean, how what course do we chart for the rest of the year? Do we need to include that in the motion, or?
I'll defer to someone on staff to give us that guidance.
Chair Bailey, I think that Dr. Hartung makes a good suggestion to you that if this is a motion to be formally made to pause the affordability reviews for this year and pick up with a new set of drugs in 2025, it should include that level of specificity. And to Dr. Hartung's point, I love the reference to cognitive activities because we all certainly have thought lots and lots about this. But to that point, to put something in that motion of meaning and substance that the board will commit to XYZ task over the remaining part of this calendar year to make a meaningful process or evaluation, including in data sources, et cetera, deference to the board and how you all would want to frame that up. But I do think in terms of candidly holding yourselves accountable to what you will likely be voting on momentarily, it sounds like to affirm that that is something that you will, an expectation that you will set for yourselves for this calendar year for a body of work.
Thank you for clarifying, Ralph. So Dr. Hartung and everyone here today then as a board, are we open to having, I guess, some brainstorming on what we would like to include in our motion? If a motion presented itself as an opportunity. Chris.
I am open to that, Chair Bailey. But I also wanted to ask the question about, is there as part of the motion or part of the follow-up from this, is there a formal notification that needs to go to the legislature or the governor to like let them know that we pause this? I know you've had the initial discussions, but I just don't. I had Mr. Judge's same concerns about I know we've talked about it, but we're not going to be meeting the defined timeline. So I just want to make sure that everyone who needs to be made aware is formally made aware and of the decision should we decide to pause. If that, yeah.
And Chris, if I may, and Chair Bailey, if I can speak on our probably shared behalf, I think that Chair Bailey and I would message directly to legislative leadership and the governor's office of our intentions and plan based on the board's vote. So yes.
So some of the things, I guess, in hearing Dr. Hartung, what he expressed as we were referencing emotion would be that, and I'm just brainstorming here, so anyone please just jump in as we're maybe wordsmithing this, that to the extent this was the will of the board, that we would be perhaps, discussing a motion to pause the 2024 affordability reviews and ensuring that we are maybe producing a summary of essentially maybe either what we've learned or that we are committed to learning more about the supply chain and defining some of our guiding principles related to affordability. Dan, I think you were much more eloquent in what you were expressing, but I want to make sure we have the language that would make board members feel as consistent with the intention behind the discussions today.
Yeah, I mean, we spent quite a bit of time kind of pounding out process. I mean, we went very fast. And so I don't think we need to obviously go back to square one, but I think having a thoughtful look at and maybe look back at the founding legislation and our rules again, just to make sure, because I think we got into a situation at around where we had, we were questioning the inclusion of certain drugs, and then, with respect to whether they were had an orphan drug status or orphan drug indications, and thinking about that. And I don't know if we have any wiggle room to modify the rules at all. But at least kind of going back that far to think about it. And then I guess that would be the kind of the step to kind of creating the candidate list, and then thinking about, I guess, data sources is the other main theme we've had. So I guess I'm like, how prescriptive do we need to say we're going to think about data, the founding principles and of selecting the drugs, data sources, and then 3 is like this issue about how we identify drugs that are have an affordability challenge for population XYZ. I guess are the 3 big themes here. And so maybe we can just propose something that like, we're going to have process related discussions around those 3 things, or maybe there's a 4th that I'm not thinking about.
Okay, Mr. Judge, you have some thoughts on helping us wordsmith what our motion might look like?
Wordsmith are us. Yeah, so my thinking is that a motion would include the following. A motion to pause the current affordability reviews until the board can establish the following: a definition of what affordability is and to whom it applies, the data that is available and can be used to make its assessments beyond claims and manufacturer price data solely, assess any changes to rules that would enable us to undertake these investigations more broadly, and then apply these elements as we investigate drugs that will be evaluated for 2025.
Dr. Hartung, do you feel like, or sorry, Dr. I didn't look up sufficiently. Dr. Burns?
Oh, that's okay. I was just gonna add, and I think you were kind of alluding to that in your last phrasing, Robert, is what I've heard, especially from Chris, is that we need a rubric that's somewhat transparent on how we're picking the drugs that we're picking. And so I would agree with the 3 areas that Dan brought up and that Robert's clarifying, and that would be the last point, I think.
Thanks, Dr. Burns. You said it more eloquently than I did.
Oh, Ralph, I see your hand up.
Yeah, thank you, Chair Bailey. I just want to make sure for clarity's sake, for procedurally, I think because Robert had initiated an original motion wherever this lands, that will need to be amended as a formal vote. I may also just advise, not cautionary, but advise that perhaps as this motion moves forward to think about this perhaps at the 70,000 foot level as opposed to the 30,000 foot level, and that I would not want you to see the board get into a conversation today that got so granular that 3 or 6 months from now, as we all acknowledge and recognize that we are a learning organization, just as there are things that we know now that we did not in October that we may have done differently, the entire habeas may regret making such a granular decision in a formal motion today that by October there could be some head scratching of what were we thinking on that day back in June. So I think a great conversation, but perhaps may not need to be way into the weeds for a formal motion.
Ralph, in hearing what you've heard us, we're kind of, when I was, desiring to have this conversation with my colleagues, I didn't, realize that we needed to have a little bit more in addition to than simply a motion. So I did not come as prepared as I could have been to this meeting with that type of information. In hearing what we've been discussing today, is there anyone on staff that might be able to help guide us where we want to meet some of our, we want the flexibility in our motion plus to achieve the goals that we're discussing today? Is there anyone else?
Sure. I mean, I think thinking out loud and wordsmithing with you as asked, I would suggest again keeping it high level, that if it is the will of the board to reset affordability reviews for next year, looking at a new set of drugs and a fresh set of data, to memorialize that in this motion. And just, again, high level, the board will commit to reviewing past processes and data sources to identify and make improvements. Full stop. I would flag or caution not making a commitment to or structuring anything that would be around our current administrative rules, and that knowing unto themselves that making changes to those rules is likely a 6-month process. So to that point, one that a parallel conversation that should happen in all likelihood, but not something that should be tied to this if you were to anticipate wanting to make substantive changes to that rule while moving forward with this process, if that is helpful.
Ralph, it was helpful. Thank you. Robert, since you seem to be our elegant wordsmither here on the board, do you have a 70,000 foot level proposal that you may be able to help your colleagues here on the board with today related to a potential motion?
Give or take 35,000 feet. But yeah, so I recommend a motion that we pause the current affordability reviews until the board, to allow the board time to review and suggest improvements, both to the criteria and methods used to select and assess drugs for potential review using a new data set in 2025.
Would that suffice as our motion for our process that we Ralph, I visually see a head nod, but I feel like Robert was motioning that when he was brainstorming.
Sure, again, deference to the board chair, Billy, and so I'm mindful of that, but I think that that gets you where you need to be in terms of the motion that is bring forward and the discussion today, and ensuring that we are able to successfully glean lessons learned and continue to grow and improve our processes, data sources, and data analysis.
Thank you for that clarification, Ralph. So, Mr. Judge, are you comfortable with the information you just presented as being a formal motion?
Yeah, I am right now.
Okay,
And
thank you.
I'm happy to second that, Chair Bailey.
Yeah.
Okay, Mr. Lehman, thank you for the second. Melissa, could you please call roll related to pausing the 2024 affordability reviews?
Dan Hartung,
I think, we get reread what the full motion we're voting on again? There's a lot of things discussed. I just want to make sure I know what I'm voting on.
And Chair Bailey, if I can be responsive to Dan's question, I do think it's important that at a minimum, it should be clear in this motion that there would not be affordability reviews conducted in 2024 based on the current work and universe of drugs.
Would it be helpful for me to restate what I said as a proposed motion?
Yeah, I think just having like I don't know, and again, like, could be already started the motion if we need to, like, we need to amend that and add to it, but yeah, just a restatement of what the motion is
Yeah.
would be helpful for me.
So it's always better to see words on a piece of paper, but verbally, it was to, a motion to pause the current affordability reviews until for 2024, to allow the board to review, assess, and improve both the criteria and methods used to select drugs for a potential review in 2025 using a new refreshed data set.
Okay, I support that. If we're still in the role.
okay, so Dan Hartung is a
Aye.
yes.
Yes,
Thank you. Robert Judge,
Yes.
Dan Kennedy, looks like we might have dropped off. I'll search quickly for Dan.
Back.
Okay. And Dan Kennedy, how do you vote?
I vote aye.
Chris Slayman,
Aye.
Joan Murray,
Aye.
Vice Chair Amy Burns,
Aye.
Chair Shelley Bailey.
Aye.
Motion passes.
Melissa, thank you for calling roll. I do want to make sure to mention for those who did sign up to speak specifically related to the affordability reviews, we do want to be mindful of the efforts you put forth to present information to the board today. So if you would like to still speak, that opportunity will be provided at the end of the meeting during the general comment period. So I guess you may want to place in the chat or directly to Melissa that you would still like the opportunity to present to the board if that is your intention. So I just wanted to make sure to be respectful of individuals' time. I guess this is for Ralph and staff. Are we, seems to me this would be the time to announce our 5-minute break. Is that in alignment with the agenda now that things have changed a little bit?
Yes, that's correct, Chair Bailey.
Okay, then I would like to announce a 5-minute break. believe it probably is now time to resume our agenda.
Yes, if we can just make sure we have our board back and on your go, Chair Bailey, we will move into this update.
No problem. Do I need to take a quick roll, or we just kind of visually see who's here and we,
I see everyone on camera except John Murray.
John, can you raise your hand or come on camera just real briefly so that we make sure we have quorum? Mr. John Murray, are you able to confirm that you are here on the meeting at this time?
Hey, Chair Bailey, don't we have a quorum with or
Yep.
without?
Okay, we do.
We do, yep.
Yes.
All good.
Thank you for the reminder and confirmation. So I would now like to call on Ralph Magrish to provide us with an update related to Senate Bill 192 upper payment limit planning. Ralph, you have the floor.
Great, thank you so much. And Melissa, if you would go to the next slide, please. All right, so board, just a bit of an update, and I'll be able to take some questions at the end if you have any. So as a refresher, we held constituent focus groups for pharmacies, hospitals, and carriers to get information and ideas from them consistent with the requirements in Senate Bill 192. We also held our consumer engagements and listening forums that you'll be hearing from Lou Savage on in just a little while. Also reminding folks that we did add 340B covered entities. And I do also want to take a quick moment and really thank those and recognize those board members who did and have sat in on these listening sessions and participated. And you heard from a couple folks, including Chris and John and Shelley. And just want to thank you for the time that you spent in that and the contributions that you've made in terms of providing meaningful feedback on content and those discussions. So thank you for that. We'll also note that in May, our chair asked that we did expand the scope of that we would expand the scope of this engagement to include pharmacy benefit managers, pharmaceutical manufacturers, and advocacy organizations. We have done so, and to that point, we did also apprise legislators that we were going to expand that scope and that would extend our project timeline, which they were comfortable with. If Melissa, if you would go to the next slide, please. Thank you. So as mentioned, we were tracking originally for a September date. That will now pivot to November based on the expanded scope of this. And to give you context for the engagement that we will be having with you as board over the next several months, we will have Myers and Stouffer with us at the August meeting and walk us through what we anticipate being a working draft report, soliciting your feedback and input in that meeting. And iterative process is what we're looking forward to with you, and presenting a second working draft in September with the board hopefully to review a final draft for approval in October and submission to the legislature in November. And if you would, Melissa, next slide. So in the constituent groups and outreach, the kind of method and approach to that has really been about developing a survey process to identify meaningful questions for those engagements. And to that point, I can tell you that a number of those have really led to issues in the way those have been framed up, and facilitating both survey and discussion groups themselves has really been about the impact of drug affordability, the desired state of drug affordability, potential impact of upper payment limits, potential constructs of upper payment limit methodologies and recommendations. And Melissa, if you would, next slide, please. Thank you. So just to show and share with you, as we've tracked that we have completed our meetings and survey processes with these groups that were statutorily called out and the 340B covered entities. Melissa, if you would, next slide, please. Thank you. So as mentioned, the expanded scope of the engagement with PBMs, advocates, and manufacturers, knowing that the surveys are in the field and that information is being synthesized now, and that will be used to facilitate meaningful and substantial conversation with these folks, both next week and into the second week of July. And currently I can give you a real-time update in terms of participant registration of pharmaceutical manufacturers. Currently have 6 registrants from 5 different manufacturers, 5 registrants from varied advocacy organizations from 5 different advocacy organizations, and of the PBMs that were invited, 6 registrants from 4 different organizations. And Melissa, if you would, next slide, please. Just to share with you the survey response rate, and I think we're quite pleased with this and don't need to run through the numbers with you, but you'll see what that is, and noting that of the last 3, that is still in the field. So feel like we're getting good information and feedback thus far. And Melissa, if you would, next slide, please. So next steps as we work through this will be to prepare for the rest of the meetings and work towards the production of a draft document to share with you and solicit feedback on in that shared collaborative process together. Other couple things that I will note is I did mention that we have a request for tribal consultation. We anticipate that happening in the next 60 days, consistent with state tribal consultation policies. The short version of that is that the tribes want to understand and the potential impacts of an upper payment limit situation or scenario on tribal pharmacy reimbursement. Some of those things are likely governed and directed by federal law in terms of IHS or Indian Health Service, federally recognized encounter rate kind of situation and process. So all things that we will learn together and share with you in those conversations and report back. And then secondly, and last piece, and happy to take questions, but on the modeling front, folks are aware that some of this is about identifying potential impact on state-funded programs as well. To that point, we are working with the PEB-OEB team and their actuarial contractor and have provided them a data set for a financial or fiscal impact analysis that we are tracking to have that information actually ready, and fingers are crossed that that will be incorporated in the August draft. And actually meeting with the Medicaid folks and their actuaries at the Oregon Health Authority tomorrow to have similar modeling conversations with them. So more to come on that. So happy to answer any other questions should board members have. Chris.
Yeah, I just wanted to say thank you, Ralph, to you and the team. I think last time we had looked at the survey responses from the hospitals and the entities, the numbers looked pretty low to us, but those look like you guys have done a great job, getting more surveys completed. So thanks for doing that work.
Thank you. Very welcome. And Chair Bailey, I think that was it, unless any other questions. And if I may introduce Lou Savage, or if you'd like to introduce Lou as our next piece.
Yeah, absolutely. Well, Ralph, if you would be able to help introduce Lou and discuss some of the information related to the Consumer Outreach Report, or introduce him so he can present that to us.
Sure. So thank you so much for that. So I'd like at this time to introduce Lou Savage, and we're very fortunate to have Lou as someone that's joined us with great expertise and knowledge and understanding of both the healthcare system and the landscape of Oregon. And Lou is the past director of the or past insurance commissioner rather for the state of Oregon. In semi-retirement, could not have thought of a better person to have conducted these community forums around the state, with Melissa as his trusty companion through that process. And again, gratitude to them for the roadshow that they did. Lou, if you'd be so kind, we'll hand off to you to walk through the summary report of your outreach. Thank you.
Sure, and thanks, Ralph. So the only other thing I would add in terms of my background is that I was a legal aid lawyer for 20 years in my early years, and I spent a lot of time representing low-income people and families who had serious medical bills. And so that at an early stage in my legal career, really informed me as to the crushing debt that a lot of folks have in trying to manage their medical costs. So anyway, happy to have been a part of this project. And as Ralph pointed out a little earlier, SB 192 really did kind of set the stage for outreach to consumers. So we're really fulfilling part of that mandate. But even more so, what this first outreach effort did was to begin an ongoing process to dialogue with consumers about the experience that they're having with the high cost of their prescription drugs. Now, the discussions we had with consumers was not just about the drugs that were under review. This was an open discussion about the challenges they were having with all of the drugs that they needed to maintain their health and in some cases maintain their life. And I just wanted to give a couple shout outs to folks who really helped to support this effort. And first was, Ralph's leadership in pushing forward on this effort, despite other really pressing responsibilities that he had. And Chair Bailey and Vice Chair Burns were present at a number of these meetings. And it really established the board's commitment to consumer outreach. And a number of consumers commented on this. Also the support of PDAB staff and DCBS communication staff, critical in putting together the forums and the report itself. And I'm hoping that everybody actually has a copy of the report, which was sent out with the rest of the materials. So, Courtney Whitlock, Steve Koyman, Jason Horton, Michael Plett, Jessica Kinnett, all helped to move this forward. And as Ralph mentioned, really my sidekick in all this, who was really primarily responsible for the success of this project, was Melissa. I learned pretty quickly that something that you probably already know, that Melissa is somebody with an array of talents and really knows how to get things done. So in terms of the forum itself, one of the goals was to fulfill, as I mentioned, the outreach efforts of the mandate that SB 192 imposed on the board. And given the initial timeline that was set to report to the legislature, these forums needed to be scheduled in April and May. So it really was a sprint to be able to get this work done. We had a number of in-person forums, as the report indicates. Portland on April 2nd, Lincoln City on April 9th, Woodburn on April 15th, Medford on April 25th, Bend on April 30th, and then online forums on May 8th and May 14th. So it really was a sprint to get these done in what we thought was the deadline for the report. The board provided Spanish interpretation in Woodburn and the online events. The board also provided American Sign Language interpretation at the Medford meeting and at the online meetings as well, to encourage folks from the Oregon deaf community to participate. We did the best we could with media in terms of letting Oregon newspapers know, TV stations, radio stations, and we did a fair amount of pushing out this information to the social media platforms as well. So again, I think we did a pretty good job with the time limitations that we had to get the word out. So the meeting format started with a review of the work that the board has done and a kind of an overview of the system itself. We talked about the accomplishments and the mission of the board, and included the recommendation that the board had to the legislature that resulted in the $35 monthly cap on insulin medication. And I will say that by and large, the consumers who were present at the in-person meetings and the online meetings were really unaware of the board's work. So really a byproduct of all of this, in addition to hearing from consumers, was really to educate the community about the good work that the board does and is doing. So, that was really an important aspect of the work that that the forums achieved. We had a total of 28 folks who shared their stories during the 7 events, and it was really helpful to have Board Chair Bailey and Vice Chair Burns at some of these meetings because they were very helpful to some consumers in educating them and informing them about some of the resources that were available to assist them in their challenges with really getting the prescription drugs that they needed and some of the financial assistance that they could have available. So the meeting ended with really an encouragement to consumers that they participate in the board's work and really become more involved in the review that the board is doing. So I think that the work that the board is doing and has done is really much more visible to the community than it was before we started these forums. So what did we learn? Well, when we were planning the forums, we really hoped that the attendance and the input we received from consumers would really be large enough to create a data set. And we just were not able to do that for some of the reasons that I'll mention in a minute. What we did learn, which I think was equally important and valuable to the board for this first consumer engagement effort, was what consumers are personally experiencing. And it really was very meaningful. So as we mentioned in the report, consumers are experiencing uncertainty with the cost of their prescription drugs. They expressed concern that insurance coverage for certain drugs that are charged, they're really uncertain about this. They're uncertain about what financial assistance programs are available for high-cost drugs. They're uncertain about the ability to access the prescription drugs that were prescribed to them by their care provider. They're uncertain about the availability of the prescribed drug. They're uncertain about the access. That includes delays that could cause serious and sometimes life-threatening health issues. Consumers expressed confusion about how much they will need to pay for their prescription drugs. The insurance coverage is not clear to them, both in terms of the cost and what specific drugs would be paid for. This includes whether a brand name drug will be approved or only a generic drug. There's confusion about what financial assistance programs are available. And several consumers expressed no knowledge at all about what programs were available, and they're confused about how they work. And consumers expressed anxiety about the future. Several consumers expressed anxiety about being able to continue to afford the drugs prescribed to them. And advocates identified consumers missing meals to be able to afford their prescription drugs. Anxiety was expressed about ongoing access to their prescription drugs, either from the changes in their insurance coverage, availability, or both. So for me, no amount of data can capture that uncertainty, confusion, and anxiety that consumers are feeling. And you can see throughout the report that we've included some thoughts from individual consumers. And we've also included summaries from the forums in the appendix, as well as the surveys that were done. So this was a first-time effort. And I will say that consumers, as well as legislators and legislative staff, were very appreciative of the work that the board did in reaching out to folks in their community. And really, the board needs to continue this effort. There's some things about the future that I think the board should consider. I think increasing consumer participation, as the board has discussed in numerous board meetings, increasing consumer participation is really a priority. There are opportunities for more planned events, more publicity, more opportunities to engage in outreach. And this should include outreach to care providers, medical clinics, hospitals. Those folks, I think, are in a really good position to provide guidance on how to reach individual consumers who are having challenges with their prescription drugs. Communities of color and marginalized communities were not as well represented as we would have hoped. We did outreach to several organizations, provided Spanish language and sign translation at several forums to encourage this. But we need to increase our efforts to make sure that communities of color and marginalized communities are more involved. One of the big questions was whether in-person forums are the best way to reach consumers and to increase consumer engagement. I think the board needs to take a look at this. Since COVID and maybe even before, folks have really become used to continuing participating online. So why would you want to travel to an in-person forum when you can attend the event from the confines of your home, really? And as you can see from the report, the participation at the online forums were multiple times more than the in-person forums. So increasing the number of online forums may be one of the keys. There's also other ways, I think, to connect with people in person. There are other organizations, including the divisions within the Department of Consumer and Business Services that have public events. And the board could leverage some of these events to connect with consumers. And as we mentioned in the report, there are also other public events that have high attendance, such as fairs, farmers markets. These are high attendance events that are an opportunity to engage with a large number of consumers. And we also heard from several patient advocate groups who expressed their interest in engaging with the board. And as Ralph pointed out, those folks are part of the effort that Myers and Stauffer is working with the staff on. So I know that they've reached out to Ralph and Board Chair Bailey. So I really do think that as a result of these forums, the board and its good work is much more visible to Oregonians. I apologize for my cold. And the board should really use this opportunity to engage consumers on a regular basis. And this is both to hear their concerns, but really to educate folks about the complex drug pricing system that folks have talked about at this meeting, at this board meeting, really. So it's clear from the engagement that we had with consumers at these forums that there's really lack of knowledge as to how the system works. And I know that there's a lot of things on the board's plate, but including outreach directly to consumers, I think needs to be one of the goals ongoing. So thanks for the opportunity to participate in this, and happy to answer any questions.
Well, Lou, thank you. Looks like we do have some questions. So Mr. Lehman, I believe your hand was up first.
Lou, thank you for all the great work and the great report, and thanks to Ralph and Chair Bailey, everyone for the work, being at the meetings, etc. You touched on it briefly about the communities of color and the marginalized communities, and you had a note in there about doing better, or maybe directly reaching out to newspapers. I think it was specific to certain communities. Are there other things, Lou, just for the board's own knowledge as we go forward with outreach to those communities that we should know about or be thinking about ways that we could have better outreach to those communities that you would recommend?
That's a great question. And you know, the staff is really stretched thin. You know, the work that the board does, you folks are really taxed. And I will say that meeting directly with folks in venues where a number of the community folks are present, I think is really the key. You know, whether it's, you know, showing up at an urban league event, or, you know, some other event that communities have, I think is really has to be the key. And you know, part of what I think would be useful would be to really put together a little strategic plan as to how to do that. You know, reaching out to members of the community, finding out when their events are happening and where they're happening, and actually being present. I don't think there's any substitute for that. And that's why I mentioned, you know, in my comments that finding out where those events are happening and tag teaming with DCBS and other organizations that are reaching out to those folks already, and have planned events may be the way to do it.
Thank you.
Oh, I've been on mute the whole time. So, Mr. Judge, I believe you had your hand up next. You have the floor.
Thank you, Chair Bailey. I want to just second Chris's comments. And I regret that I wasn't able to join in these because they were scheduled with not enough time for me to kind of adjust my schedules to participate where I could. But yeah, I totally understand. Commend you on the work first, because it's a start. It's a, you know, these are ways for us to engage in the community, as you said. As we think about these, and I'm not sure that this is an ongoing recurrent thing as a strategic plan that you referenced as a suggestion, but to the extent that we're setting up for these, to what extent did we coordinate with like the ombudsman's office inside of OHA or the Office of Equity and Inclusion and or county health departments to kind of, you know, these folks have feet on the street and they're engaged in all parts of the state. Did we go down that path or?
Well, yes, we did go down that path, but unfortunately the runway was too short. You know, that you know, so I think that we can do that. So we don't need to reinvent the wheel in terms of, you know, connecting with those community groups. I think that those opportunities are there. You know, not, you know, so next time around, we will have hopefully we'll have a longer runway, and, you know, make connections with those folks earlier on, so that, yeah, we plug into existing events and existing connections. So yeah, I think that's the key.
Perfect. Thank you, Lou, and thank you, Mr. Judge. Mr. Murray, I see that your hand's up.
Yeah, I just wanted to also thank you for your report and your hearings that you held throughout the state. In your conclusions about consumer anxiety and the worries that patients have about turning in a prescription. I don't know how many of us realize that when a prescription goes from the doctor to the pharmacy, or the patient brings it in.
Mr. Murray, so that you're aware, we may have a connectivity issue and we cannot hear you at this time.
That you mentioned in your report are so very real, and we see it every day. If nothing else, I will take from this one of my goals as a PDAB board member in some small way to reduce the anxiety that consumers have about these kinds of things, about these issues, and how can we make prescription drugs more affordable. I have no doubt they're interested in our work and appreciate our work. It will be my marching orders going forward to try to help address these issues. This helps define to me what affordability is. So thank you for your work.
Yeah, and I will say that you know, I was an advocate for 20 years and participated in a lot of work groups and forums. There is nothing like hearing directly from a consumer. There's just, you know, there is really no substitute for that. And so the reason that we included some of those comments in the report is they were not filtered at all by an advocate or any other organization. We heard directly from the mouths of consumers.
Well, Lou, thank you very much for your update. And again, before we move to a couple comments for me, does anyone else have any questions for Lou? All right, well, again, thank you for Lou for the work of yourself and Melissa and your team on presenting this to us today. I would like now to announce to my colleagues today and to everyone here listening that at the July 24th, 2024 meeting, the board will hear from a stakeholder panels made up of manufacturers, pharmacy benefit managers, advocacy groups, pharmacies, insurers, hospitals, consumers, and others. This discussion will be about upper payment limits. I will be working with staff to create the agenda, providing time for panelists to speak, followed up by board questions. And we will be sending these invitations out in the next week. So again, this was just really a follow-up, and even specifically, I think, to some questions Dr. Burns proposed earlier in the discussion, but I just wanted to make sure to share with everyone here today that that is how I've been working on the July agenda, so that we really are hearing from all of these voices before we proceed with the good work that we're doing. So I guess now moving forward, I would like to announce that our next board meeting is on July 24th, 2024 at 9:30 in the morning. And I would like to ask the staff if there are any additional announcements before we move on to the general public comment period.
Thank you, Chair Bailey. No additional comments at this time. Just again, recognition and gratitude to the work that Lou and the team did, and to those of you board members who participated and engaged with that, but also to all of the consumers and folks out there that came from around the state. I'm thinking that there are some of those folks that have signed up and become actively engaged and are probably watching right now. So gratitude to you for coming out and sharing your truths, and for joining us today. So no updates. Thank you, Chair Bailey.
All right, well, thank you, Ralph. And so we are now moving to the portion of our agenda related to public comments that were submitted or requested in advance. The board did receive 7 general written comments, which are posted on the board's website. Written comments are reviewed by the board prior to the meeting. And I will go ahead and read for everyone here today the written comments, or excuse me, those who provided general written comments. Tom Brownlee from Pfizer related to biologics. Daria McGrew from Pharma related to the generic drug report. Katie Cohen from the Oregon Business and Industry related to April's meeting concerns. Tony Colejo from the Partnership to Improve Patient Care related to value assessment and disability engagement. Michelle Cole from Tualatin Voices for Affordable Health related to drug costs. Andrew Kitchen, who's a caregiver related to ulcerative colitis and Humira, and Ann Kitchen, who's a caregiver also related to ulcerative colitis and Remicade. And again, I do want to also reinforce, I'm not reading them at this time because we did not proceed with the affordability reviews, but we did also receive written comment and request for testimony from some stakeholders. So if those individuals do want to participate in this general public comment period, please send a note in the chat or communicate with Melissa so that we can make sure that your voice is heard today. But moving forward, related to someone who did request to speak during the general comment period, let's see, I will go ahead and mention that Daria McGrew did request an opportunity to speak here today during the general comment period. Daria, I would like to remind you if you could please restate your name, and I'll reinforce that you do have 3 minutes here to speak today. As a reminder, the board does not deliberate on issues or requests that are provided during the general comment period. So Daria McGrew, you do now have the floor, and please keep in mind the 3-minute time allotted.
Thank you, Chair Bailey. Confirming you can hear me.
We can hear you.
Okay, thanks. Daria McGrew on behalf of the Pharmaceutical Research and Manufacturers of America. Thank you for recognizing me. We continue to share the board's belief that affordability of medicine is an important conversation. I am pleasantly surprised by the motion and the outcome today. Thank you, Chair Bailey, for bringing this up and your leadership, and thank you all for this deep discussion today. We know all the board members intend to fulfill the statutory requirements to do transparent, detailed, and fair analysis without foregone conclusions. The board and staff have done a ton of work so far, but have been hampered by missing data and incomplete tools that would allow you to do a nuanced deep dive. And there has you have been forced in the past to rush the work to try to meet these deadlines. So I really just applaud the conversation today and acknowledgement that although this is an iterative process, it is also absolutely crucial to be consistent, to treat all analyses and drugs and medicines fairly in your analysis. So while improvements have been made, I think it is the right decision to pump the brakes, reevaluate, and ensure that the work is complete and consistent moving forward, and appreciate that all that work and the conversation today, and look forward to being a partner moving forward on education and deeper dive. Thank you.
Daria, thank you for sharing your comments today. Everyone, please have a little flexibility with me related to additional voices that had signed up to be heard. Again, just because our agenda changed a bit by not pursuing the affordability reviews. So I guess I would now, just kind of looking at those who have signed up to speak, I guess I would just like to ask now, would Leonard Friedland from GSK like to provide any general comments to the board here today? And Melissa,
Chair Bailey, Leonard is not on the call.
thank you. So just help me efficiently go through this list, Melissa. I do greatly appreciate it. The next individual who did request to speak was Candace Robinson from GSK.
Candace is no longer on the call.
Thank you for that. Moving down the list, Corey Greenblatt from the Global Healthy Living Foundation. Corey, would you like an opportunity to present to the board today?
And I don't see Corey on the call today.
Okay, I know Melissa, I believe you received some communication from Lauren Sant and Carrying Ambassadors.
Correct, and Lauren had to leave at 11, so Lauren is no longer on the call.
All right, thank you for letting me know that. The next individual was Olivia Canine from the Global Coalition of Aging. Olivia, would you like to use your 3 minutes at this time?
And I do not see Olivia on the call.
All right, well, then I believe we have Dr. Ashish Pradhan, the Executive Medical Director for Neuroimmunology from Genentech. Dr. Pradhan, would you like an opportunity to present during this general public comment period?
Dr. Pradhan is on the call, so I will change your settings, Dr. Pradhan, so that you can use your mic and camera now, if you would like to speak.
Sure. This is Ashish Pradhan, Neuroimmunology Executive Medical Director at Genentech. So thank you for providing the opportunity to comment. We appreciate the thoughtful discussion held by the board today. We do not have any comments following the discussion today, but thank you again for the opportunity.
Absolutely. Thank you for being here today. And then we next have Tiffany Robertson from AI Arthritis who signed up. Tiffany, would you like an opportunity to speak during this general public comment period?
Tiffany was on the call earlier, but is not now. Chair Bailey.
All right, well, Melissa, thank you for confirming that. So with there being no further business before the board, we do need a motion and a second to adjourn the meeting. All in favor of adjourning the meeting, Mr. Robert Judge, your hand is up. You have the floor.
Thank you, Chair Bailey. And I know I'm out of sequence with this question. It just popped into my head. We did an affordability review determination on insulins early this year. Is that paused as well?
My understanding would be when I was making a suggestion to facilitate this dialogue with my colleagues today, that we would not be putting forth any medications, including insulin, just so that we're inconsistent with our processes moving forward. So that was my intention with making that a suggestion to the board today, but I did not clarify that. So thank you for mentioning it.
Okay, thank you.
Absolutely. So if there is no further business before the board, we do need a motion and a second to adjourn the meeting. All in favor of adjourning the meeting, please say yes.
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 And any opposed, please say no. All right, well then, I would like to announce that the meeting is adjourned. And again, I would encourage everyone listening in today to join us at our next meeting, which is July 24th at 9:30 a.m. Pacific. Thank you, everyone.
Thank you.
Thank you.
Thank you.
Thank you.